Bismillah. It is a great honor for me to be here with you today. Thank you so much, organizers, for inviting me for this great event. This is a great milestone for the Somalia as well as for the whole continent. MashaAllah. My name is Dr. Abdulaziz Hussein. I'm a neurosurgeon. Today I will be discussing with you rare case of spine. Some of you may question, spine, is it for orthopedic or spine is for neurosurgeon? Spine is a shared center, that is teamwork. There is a spinal cord inside the spine bone. So the orthopedics manage the bone. Sometimes we manage the bone and the nerve as well. So it is a shared area. So it is a teamwork. So disclosure, I have nothing to disclose. Spine surgery, I'm working now currently at Somali Sudanese Specialty. We are operating a range of spine pathologies, starting from C1 up to sacrum. We are doing the disc surgeries, as well as laminectomy, simple one, and we are also fixing fractures and degenerative diseases in whole spine. So these are the cases in the lower lumbar area. This is a lady which came with severe back pain, with bending, so we fixed it for her. We are also doing mid-lumbar pathologies. We are doing pedicle screw fixation for lumbar area. We are doing also thoracolumbar junction with fixation very well. We are also doing high thoracic as well. These are case examples. Let me go to our today's topic, cervical cases. So I will be discussing with you some of the interesting cases. The first case, this is a 42-year-old female lady. She came to us with a complaint of neck pain with radiculopathy with upper extremity, as well as she was complaining full dysfunction of the spinal cord. That means she is unable to work, she has weakness, she's unable to feed herself, changing clothes. Almost she was quadriplegic. When you evaluate her in examination, her brain is totally normal. This is 50 side, it shows us right side cranial nerve 11 dysfunction. In power as well, she has also reduced power more on the right side. So we did imaging, MRI, which shows us, I think it is visible for you. There is a tumor here. There is a tumor at the junction of the brain and the spinal cord. This is called intradural extramedullary tumor. Outside the spinal cord, but inside the dura. So it is causing here quadriplegic. This is with MRI with contrast. So we evaluate her in detail. We advise her all the possible things at this critical area. So she opted to be managed surgically. So we keep her in prone position. The first picture shows you the prone position on horseshoe head holder. Then dress draped. Then we start surgery. C1. This is the first C1 cervical, C2 cervical, C3 cervical. Because the tumor is in the C2 cervical area, we have to expose 3 of the cervical areas. So we expose that way intraoperatively. As soon as we open the dura, the spinal cord was on top of the tumor. When we retract the spinal cord, cranial nerve 11, which is causing the weakness on the shoulder, was covering the tumor. So we resected the dendritic ligament, the ligament which connects the spinal cord with the dura. Then we retract the spinal cord. Then this is, you see white thing, that's the cotonoid above and below, the section showing the tumor area. So we start dissecting, devascularizing according to based on the principles. So we removed it with 3 pieces. This is the last piece of the tumor. So we stabilize, we secure hemostasis. Then at the end, it is anatomical. At the spinal cord, the clear fluid is safe, clearly perceiving the spinal cord. The one I'm holding on pickup was dura mater. So at the end, the spinal cord was good for setting. So the tumor was removed already. We repaired the dura. We did post-operative control MRI. You see that MRI is post-operative. There is a white lesion at the level of cervical 2 area now, which is completely out. It is completely rejected. The patient, she start to have improvement immediately after surgery, and at the end of the month already she fully recovered. At third month follow-up, surprisingly, her husband asked me to shall I start Champions League, that means bed play. Mashallah, I said them, you are free to enjoy your life. Now she is, mashallah, they are enjoying. A second case, also I will make it faster. This is also one of the rare cases, not only here rare, internationally it is rare case. We may found up to 10 case reports on this case. This is a 29-year-old young man who came to us after visiting multiple hospitals. He came to us with neck pain, with radiculopathy and weakness in all extremity, like the lady. And he has multiple body burn, traditional burns in the skin. They were burning the following whole skin. So we examined him, then we investigated him with MRI. There was MRI from Dick Fair, which show us, if you see here, it is cervical bone. It is C1, C2, C3, C4, C5. C5 is completely injured, and there is a mass compressing the spinal cord, which is causing quadriparesis. So this is one of the challenging cases. Based on the reports, physical examination finding, and our evaluation, we consider as a TB. It is spine TB. Already he started TB treatment, but not improving. So we advise him to go abroad, because it's one of the critical things. We advise him to go to abroad, but he is having severe financial compromise. So we give him option. Now he's quadriplegic, we have to do something. What we have to do? We have to remove that vertebral body completely. We have to remove that tumor, and we have to put implant. But in our setup, as we know, the setup is not ready for this one. Because the complication is grave, but we decided to take him to the OT to remove the mass. We were thinking it is tuberculosis. Intraoperatively, as we know, TB is easy to remove. The X-ray shows complete destruction of C5. So we took him to the OT, we prepared his neck. That image is his neck, anatomically marked, the iliac bone, marked for iliac bone crust graft, draped and prepared. The difference is intraoperatively we found significantly bleeding mass rather than TB-like infectious material. So it was bleeding mass. Already, let me show you. That is when we removed the C5 completely. We removed the tumor completely, so it is disconnected above and below. So we have to put graft. So we prepare a bone graft from his iliac bone. Then we fix it. We put that bone graft in that space. Already the space filled with that one. Then we took intraoperative CRM. It was good. Then he showed significant improvement, but the pathology came to us as hepatocellular carcinoma meeting to the spine. Only 10 cases reported in the world. Hepatocellular carcinoma is one of the grave things. But for the patient, we found him clinically. At second day, I found him walking. Then at the end, we linked him to oncology center for the further treatment. Thank you so much. Glad to be here with you.